Graves' disease is an autoimmune disease and not a disease of the thyroid gland. An autoimmune disease is where the immune system attacks the body's own cells and organs rather than a normal immune system would fight off bacteria and viruses that are not known to the body. Graves' disease is a type of hyperthyroidism, which is when the thyroid gland has an overproduction of thyroid hormone. And on the opposite end, there is hypothyroid, where the thyroid gland has an underproduction of thyroid hormone, and hypothyroidism, which would be an underproduction, can cause diseases such as Hashimoto's disease. But Graves' disease is when there is an overproduction of thyroid hormone due to an irregular immune system that has an autoimmune disease. Research around the genetic links of Graves' disease is unknown regarding a specific gene or genes related to the autoimmune disease. However, we do know that there is a genetic predisposition for Graves' disease, in that those that have it have family members who also have Graves' disease. However, a mom is not able to pass on an overactive thyroid to her child, but she's able to pass on the genetic predisposition for an autoimmune disease to be more likely to occur. 2 to 3% of the population has Graves' disease. This is not considering the other types of hyperthyroidism and hypothyroidism and thyroid disorders in general. And 5 to 10 women are 5 to 10 times more common to have Graves' disease than men are. So this is a predominantly woman influencing disease that can be related to the fact that it is coming from a gland that regulates hormones. So maybe the imbalance of estrogen or progesterone can be causing the thyroid hormone and production from the pituitary gland to cause an imbalance in the leading to the thyroid gland. And women are more likely to have it around their age 20 to 50, so it's at kind of the peak of the productions of hormones in women, is when Graves' disease is being shown symptomatically. This image is showing the process of how the thyroid gland receives signals and releases hormones. The pituitary gland releases signaling for hormones, and one of the hormones that it produces and releases is the thyroid stimulating hormone, which is TSH. So pituitary gland produces TSH and sends it off to the thyroid gland. And the thyroid gland then produces the thyroid hormone, and what you see below is T3 and T4, which are two different types of thyroid hormones that then are signaled back to the pituitary gland to tell the pituitary gland how much thyroid hormone is being produced. So where if more thyroid needs to be produced or less, the pituitary can then signal out the TSH, which is the stimulating hormone, to produce the thyroid hormones in the gland. This image shows a side-by-side representation of what a normal process from the pituitary to the thyroid would be and what happens with an individual who has Graves' disease to the right. So from the hypothalamus is where the original thyroid releasing hormone is produced and sent to the pituitary gland, which then produces and releases a thyroid stimulating hormone, which then travels to the thyroid gland and should in turn release T4 and T3 that goes back to the thalamus and relays the levels of thyroid that are being produced by the thyroid. This is essentially called a feedback loop, and as you can see, those with thyroid or those with Graves' disease have an immune system that makes an antibody called thyroid stimulating immunoglobulin, which is TSI, as you can see on the right of the Graves' disease, which is being added in. So the autoimmune disease or the immune system comes in and adds in the TSI antibody, thyroid stimulating immunoglobulin. So it's essentially stimulating the thyroid gland to produce more thyroid hormone. And so the thyroid gland mistakes this thyroid stimulating immunoglobulin for the TSH that should be coming in from the pituitary in a normal process, and then attaches to the thyroid cells and causes the thyroid gland to have an overproduction of T4 and T3 levels. So there are an array of symptoms that Graves' disease can bring forth, and I've tried to outline a few of them in this slide, and there is a process, or what I'm trying to show is that one can bring forth the rest of them, and what is internally happening can cause physical or phenotypical symptoms that one can notice. And for example, the first one is a high pulse rate. So when the thyroid gland is overproductive in producing the thyroid hormone that regulates things such as body temperature, then one has a high pulse rate, and that can cause rapid breathing, and a high pulse rate can also cause a high metabolism because the body is constantly working to maintain the high pulse rate. And a high metabolism